It is indeed a good morning to you, Wahome, back there at Broadcasting House, and we're coming live to you from the Freedom Tree. It is just right behind the Coast Provincial General Hospital, where the Health Workers Union are having a briefing for the journalists, just to give a strike notice that from today midnight they will be going on strike because the county government of Mombasa has not heeded to their demands. And I'll just be joined by the branch secretary of the Health Workers Union, who's just going to give us a brief of why they're going to be on strike from today midnight. Karibu sana Bwana Franklin. You'll start with your names first and your position, and then you'll tell us why you're issuing this strike notice.
I'm Franklin Makanga, Branch Secretary, Kenya Union of Clinical Officers, and today we are here as the 5 health unions that we came together to form the Health Unions Caucus in Mombasa. We are having the Kenya National Union of Nurses, the Kenya National Union of Pharmaceutical Technologies, the Kenya National Union of Medical Laboratories, and the Kenya Health Professional Society. So we came together to issue a strike notice on 3rd January, which is expiring today. It was a 7-day strike notice. And the issues in that strike notice are: 1, the issue of unpaid salaries, that is November and December salaries; the issue of lack of comprehensive insurance cover, which has not been in place for the last 1 year; and the issue of unremitted statutory deductions. These are issues that we've had them for the last 2 years. We have always been going on strike because of these same issues. Now, for the salaries that have not been paid, we are in full knowledge that the disbursement from the National Treasury was disbursed to the county in November, 700 million. And again, in December, similar amount was disbursed, but salaries were not paid. We are told money went into other activities. So we, as healthcare workers, we went ahead to issue a strike notice because that's what the law allows us to do. And we went ahead to meet the employer and the management, but we were not able to get solutions. So we've consulted our members, and despite the request by the administration that we extend the strike notice, our members have refused because they don't have even facilitation for them to go to work. So we are saying from tonight, midnight, there will be no services in Mombasa hospitals. All the health facilities under the government of Mombasa County, there will be no services. And we are saying this, that we will only come back to work when our salaries have been paid, the 2-month salaries, not 1 month salary, and when the NHIF cover has been actively implemented and people are now able to access the services. So those are our bare minimums. For the other issues, we can sit and discuss, but for now, before we meet, before we have any meaningful discussion, we want to ask the employer and the Mombasa County government to take responsibility and ensure that salaries of our members have been paid and money is in their accounts, so that they can facilitate even their children to go back to school.
So what happens to the Mombasa residents who will be visiting the hospitals, especially now that there are those who have been admitted? What happens to them?
For those who are admitted, from Friday, we've been asking the administration to start discharging those patients. And those who will be seeking the services from our hospitals, from today, we wish to advise them to seek alternative places to get services. They can either to go to neighboring counties or to go to the private facilities. Because from tonight, it's so unfortunate, because our desire is to serve the Mombasa residents, but it's so unfortunate that we are exposed to this inhumane treatment of us not getting our salaries, which has now resulted into us disrupting the services. So unfortunate.
You've heard it from the horse's mouth. It is going to be a very sad situation if at all the health workers from Mombasa branch go on strike from today midnight. Back to you in studio, Wahome.